Exactly you are doing here today and kind of what your role is here.
This is our emergency sideline course. This is the second annual time that we've had this event, and the purpose of this is to bring together the professionals from around the community that take care of our athletes on the sidelines. We have our physicians, athletic trainers, and EMS coming together to learn and practice life-saving skills that hopefully we don't need, but we're ready to utilize if we do need them on the sideline on Friday nights or other sporting events.
Okay, so how did you get asked to be a part of this specific clinic?
So this clinic was the idea of two of us. We had a similar event where I came from previously, and we wanted to implement this for everybody in East Texas because athletics are so vital to the community here in East Texas. We want to make sure that we're prepared and our community responders are prepared to handle anything that could occur on the sideline.
Can you tell me a little bit what it's like working with student athletes specifically?
Student athletes are so much fun to work with. They're really the heart and soul of athletics. They're the ones that are coming out. They want to be out there. They work hard. They're giving everything to the sport, and they're putting everything out there on the field. They're so fun.
And what does it feel like to be able to provide medical care to these students?
Really, it's an honor and a blessing. For me as a provider, I get to step outside the clinic and give back to the community, but then I get to help them achieve their dreams and be out there if there is an emergency, hopefully to keep them achieving their dreams, making sure that they're safe and getting the care that they need.
So what kind of sports events are you attempting to help out with?
Yeah, Friday night football is one of our big ones in the fall. We also cover the UT Tyler athletics, so we're primarily at soccer and basketball because those are more of the contact sports, and then we'll go to some of the other sports really around the community, both UT Tyler, so like volleyball, softball, baseball, and then in the community there's a bunch of mass participation events that we'll go to, big races, bike tours, some of the other events.
And how did you get into this field?
Growing up as an athlete, of course, everybody tends to succumb to an injury at some point, and I had a physician that I remember sitting there thinking, he doesn't want to take me out of my sport, he wants to keep me going in my sport. And that was the first time that I realized that there are doctors out there that have that mindset, and I immediately wanted to be one. So it took a little while to figure out exactly how I would achieve that, but I knew I wanted to work with not only like the athletes that are out there on Friday night, but the people that want to be active going forward to keep them active, because that's really the foundation of health.
Yeah. Okay, so you obviously have a lot of people here from kind of all over the place, different organizations, different job backgrounds. What are you hoping that everyone gets out of today?
I would love for everybody that's here today to not only feel comfortable with these life-saving skills and have that good foundation of knowledge, but also just to understand their role in this multidisciplinary team. Like I said, it's athletic trainers, physicians, the EMTs that are out in our community. We need to work together as a team because none of us can do this on our own.